Hepatitis is a big deal. It's a condition that affects millions worldwide. The word hepatitis means inflammation of the liver. This inflammation can be caused by various things. Viruses are the most common cause, but alcohol, drugs, and autoimmune diseases can also lead to hepatitis. There are 5 main types of viral hepatitis: A, B, C, D, and E. Each type is caused by a different virus and spreads in different ways. Some types can be short-term, while others can last a lifetime. Hepatitis can range from mild to severe, leading to serious complications like liver failure or liver cancer. Understanding hepatitis is crucial for everyone's health. We need to know how to prevent it and treat it if necessary. In this essay, we'll explore hepatitis in detail, including its types, spread, effects on the liver, diagnosis, treatment, and prevention. By the end, you'll have a good understanding of this important health issue. Let's start with hepatitis A and B. These are 2 of the most common types. Hepatitis A is usually short-term and spreads through contaminated food or water. It can also spread through close contact with an infected person. Hepatitis B can be both short-term and long-term, spreading through blood and other body fluids. This can happen through unprotected sex, sharing needles, or from mother to baby during childbirth. Hepatitis B is more serious than hepatitis A. Both can cause symptoms like fever, fatigue, nausea, and jaundice. The good news is that there are vaccines for both hepatitis A and B. These vaccines are very effective at preventing infection. Hepatitis A usually clears up on its own within a few weeks or months. Hepatitis B can be more complicated. Some people clear the virus naturally, while others develop chronic hepatitis B. Chronic hepatitis B requires long-term management to prevent liver damage. Vaccination is a key prevention strategy. Understanding these basics helps in recognizing and preventing these infections. Next, we'll look at the lesser-known types of hepatitis. Now let's look at the other types of hepatitis. Hepatitis C is spread through blood-to-blood contact, often through sharing needles or other drug equipment. Hepatitis D only occurs in people with hepatitis B. It makes liver disease worse in people with hepatitis B. Hepatitis E spreads through contaminated food and water. It's more common in developing countries. These types can still cause serious health problems. There's no vaccine for hepatitis C, D, or E. Understanding these types is crucial for awareness. Understanding how hepatitis spreads is key to prevention. Hepatitis A and E spread through the fecal-oral route, often via contaminated food or water. Hepatitis B, C, and D spread through blood and body fluids. Sharing needles or other drug equipment is a common cause. Unprotected sex can also lead to transmission. Healthcare workers can get these types through needle stick injuries. Mothers can pass these viruses to their babies during childbirth. Activities like getting tattoos or piercings with unsterilized equipment carry a higher risk. Sharing personal items like razors or toothbrushes can also spread hepatitis. Blood transfusions are a rare cause in countries with good screening practices. You can't get hepatitis through casual contact like hugging, shaking hands, or sharing meals. Understanding these transmission methods helps us take the right precautions. It's a key part of preventing the spread of hepatitis. Next, we'll explore the causes of hepatitis in more detail. Knowing how hepatitis spreads empowers us to protect ourselves and others. Let's move on to the etiology of hepatitis. Section 5. The etiology of hepatitis. Etiology means cause. The main causes of hepatitis are viruses, specifically hepatitis A, B, C, D, and E. Each virus is different and attacks the liver in its own way. But viruses aren't the only cause of hepatitis. Alcohol can lead to liver inflammation, known as alcoholic hepatitis. This happens when people drink too much alcohol over time. Some drugs, both illegal and prescription, can also cause hepatitis. Autoimmune hepatitis occurs when the body's immune system attacks the liver. Certain toxins, like those in some wild mushrooms or industrial chemicals, can also cause hepatitis. Understanding the etiology of hepatitis helps doctors diagnose and treat the condition correctly. For example, viral hepatitis might be treated with antiviral drugs, while autoimmune hepatitis requires different medications. Knowing the cause also helps with prevention. We can take steps to avoid the things that cause hepatitis. This knowledge is crucial for effective management and prevention. Next, we'll look at how hepatitis affects the liver. Understanding the causes of hepatitis is the first step in combating it. Section 6. How hepatitis affects the liver. The liver performs hundreds of vital functions. Hepatitis affects the liver's ability to do its job. Inflammation prevents the liver from working properly. Hepatitis causes liver cells to swell and die. Damaged cells impair liver function. The liver struggles to remove toxins and produce proteins. This leads to symptoms like fatigue and nausea. Hepatitis can cause fibrosis, forming scar tissue. Long-term hepatitis can lead to cirrhosis. This increases the risk of liver failure and cancer. Early detection and treatment are crucial. Diagnosing hepatitis tests and procedures. It starts with a physical exam and medical history. Doctors ask about symptoms and risk factors. Blood tests confirm hepatitis. They look for specific markers and liver inflammation. Tests detect antibodies to identify hepatitis type. For example, hepatitis B surface antigen. Other tests assess liver function. Imaging tests like ultrasound or CT scans may be used. They show liver size, shape, and damage. Sometimes a liver biopsy is needed. Accurate diagnosis is crucial for treatment. Early diagnosis prevents complications. Get tested if exposed to hepatitis. Next, treatment options for hepatitis. Section 8. Treatment options for hepatitis. Treatment for hepatitis depends on the type and severity. For acute viral hepatitis, treatment focuses on managing symptoms like rest and hydration. Chronic hepatitis often involves antiviral medications. New drugs can cure hepatitis C in most people. Hepatitis B is harder to cure but can be controlled. Severe cases may require a liver transplant. Lifestyle changes like avoiding alcohol are crucial. Section 9. Prevention strategies for hepatitis. Preventing hepatitis is easier than treating it. There are many ways to reduce your risk. Let's start with vaccines. There are safe and effective vaccines for hepatitis A and B, often given in childhood but available for adults too. There's no vaccine for hepatitis C, D, or E yet. Good hygiene is crucial for preventing hepatitis A and E, including washing hands frequently. When traveling to areas with poor sanitation, be careful about what you eat and drink. Avoid raw or undercooked foods and stick to bottled water. To prevent hepatitis B and C, avoid contact with blood and body fluids. Don't share needles or other drug equipment. Practice safe sex by using condoms. Be cautious about tattoos and piercings, ensuring they're done in clean, licensed facilities. Healthcare workers should follow safety protocols to avoid needle stick injuries for all types of hepatitis. Avoiding excessive alcohol use is important. Alcohol can damage the liver and make hepatitis worse. It's also important to be careful with medications, following your doctor's instructions and not taking more than the recommended dose. Prevention is the best strategy for combating hepatitis. Section 10. Maintaining liver health. A healthy liver is crucial for overall health. There are many ways to keep your liver in good shape. Let's start with diet. Eating a balanced diet helps your liver function well. Include plenty of fruits, vegetables, and whole grains. Limit fatty and sugary foods, which can put extra stress on your liver. Exercise is also important for liver health. Regular physical activity helps maintain a healthy weight, reducing the risk of fatty liver disease. Aim for at least 30 minutes of moderate exercise most days of the week. This could be brisk walking, swimming, or cycling. Limiting alcohol intake is crucial for liver health. If you drink, do so in moderation. For men, this means no more than 2 drinks per day. For women, it's no more than 1. Some people may need to avoid alcohol completely, especially those with liver disease or a history of alcohol abuse. Finally, be careful with medications and supplements, following dosage instructions and talking to your doctor before taking any new supplements. Maintaining liver health is a proactive way to prevent hepatitis and other liver diseases. Section 11. Conclusion. Living with and beyond hepatitis. Hepatitis is a serious condition, but it's not a death sentence. With proper care and treatment, many people with hepatitis live long, healthy lives. The key is early detection and appropriate management. If you've been diagnosed with hepatitis, work closely with your healthcare team. Follow their advice and take your medications as prescribed. Living with hepatitis often means making lifestyle changes, like avoiding alcohol, eating a healthier diet, and getting regular exercise. It's also important to protect others by practicing safe sex and not sharing personal items. Research into hepatitis is ongoing, with new treatments being developed all the time. For example, there's hope for a hepatitis C vaccine in the future. There are also efforts to improve existing treatments, giving hope to people living with chronic hepatitis. Remember, hepatitis is preventable in many cases. By understanding the risks and taking precautions, we can reduce its spread. If you haven't been tested for hepatitis, consider doing so. Early detection can make a big difference.